What's up, YouTube? Welcome back. Dr. Chad Connor here, Board Certified Internist, and today I have a very good friend of mine, University of Colorado Infectious Disease Fellow, Dr. David Fraulino, joining us for an interview. Welcome, Dr. Fraulino.
Thank you, Dr. Connor. Good to be here. It's good to see you again.
Yeah, absolutely, man. It's been a minute since you moved out there. How are you liking Colorado?
We love it. We obviously love it. It is probably the coming home that I was waiting for all these years. We like it quite a bit. The altitude took a little time to get used to, but we're enjoying it quite a bit. I got a view of the Rocky Mountains right outside my bedroom, so I can't beat that.
You can't beat that. And I see that the beard grows just as nicely there as it does in Connecticut. It looks very luscious.
I was going to say, I don't know if like the deprived oxygen in some way stimulated the growth, but this is 5 months after my post-COVID shave that was shocked the world. But here we are. I feel like I have life again.
It's beautiful. If my daughter ever needs a Santa Claus, I'll make sure to hire you. We can just dye it white or something.
In infectious disease, we don't make very much, so I'll probably take that side hustle if you offer it to me.
Well, I'm glad that you mentioned it. So let's get started here. That you are an infectious disease, fellow. Tell us, what exactly is the study of infectious disease?
Yeah, that's a good question. I don't know if I've ever really had to define that term per se, but I imagine like a good encompassing term is just like all the diseases that are caused by a living organism, because it obviously ranges from bacterial infections, viral, fungal. I would say that obviously probably predominates the scope of what I see on a day-to-day basis, but yeah, it's a unique field in that sense because it really does cover a whole range of practices. As a medicine resident, was fairly confined to our medicine patients, but now I'm back on the surgical side of things as well. So it's a very wide range of patient base, and it's all different types of infections, both mild to severe, and obviously with the recent pandemic, that's expanded quite a bit even more. So it's many different hats all under the same umbrella.
Yeah, I mean, I know you brought up the pandemic. Tell us a little bit how that's affected the day-to-day life of an ID doctor, and how has it changed your practice?
Yeah, great question. Truthfully, when I decided to go into infectious disease, I think the idea of a pandemic was a theoretical risk that some may have predicted to be lurking around the corner, probably more soon than a lot of us cared to admit. But I never obviously thought that it would kind of come, so abruptly in my face at the very beginning of fellowship, no less. So it certainly dominated, a lot of the airwaves for my training so far. I think my program, and I don't know if this is true for every program, but they've done a really good job of it, making sure that my fellowship isn't centered around, COVID. That being said, it's obviously a huge component in the same sense. So I'm lucky because at University of Colorado, it's one of the top pulmonary programs in the country. So we work very intimately with the pulmonologists and even the infectious disease doctors who, were helping to, start the studies, run the convalescent plasma studies, the vaccines, all those things. We were pretty much on the front lines kind of gathering that data. So I felt very much up to speed. I felt very equipped and well-informed all along the way with the most novel therapies. So I was lucky in that sense. And I feel like, even though it's a daunting task to kind of start fellowship amidst the pandemic, I think that we have the tools to make it, a little bit less harmful.
That's awesome. I'm glad you're having such a good experience already. And I think it's really important that you're still seeing all that bread and butter infectious disease, right? Because that's going to be the backbone to your practice eventually. COVID will hopefully not be around as you begin to practice as a full-fledged attending. So really nice to hear that you're still getting that full scope of experience. And
yeah.
So what made you choose infectious disease? I know obviously the pandemic wasn't a thing at that time.
When I was in college, I did parasite research. I went to Salve Regina University in Newport, Rhode Island, obviously right down the street from you at the University of Rhode Island. And I started with Leishmania research that I really did enjoy. And then after college, I took some time off to do more research in immunology. And I think the idea of, an infective organism kind of inducing this, host response and the, battle back and forth and jockeying for position of power in that whole pathophysiology, super interesting to me. And residency, I think, you're kind of figuring out where you fall into place. Are you procedure heavy? Are you not? Things like that. And it became very clear to me that I kind of leaned more towards maybe a more cognitive specialty where I didn't have to rely on my hands for everything. And, bugs and drugs, when it comes down to it, I think they're the coolest. And it's probably like super nerdy for me to say, but it's honestly one of the coolest specialties, I think. The pandemic, I think, brought some light into the field that otherwise wasn't there because it wasn't, terribly popular. But, I think there's a lot of longevity in it. It's a super interesting cases that you read about in med school that you think you'll never see. And then all of a sudden they're on your doorstep. So it's never, a dull day. And I think that it'll continue to serve, that sort of entertainment spark for my entire career.
Yeah, couldn't agree more. And with the rising population, only likely worsen. So you're certainly going to have plenty of patients to treat and take care of for your entire career.
Yeah, agreed. Every time a physician leaves someone on, antibiotics for 2 weeks longer than they should, I kind of just view that as job security because they're just self-selecting the resistant bugs, and I got loans to pay off, so I'm all for it. But no, there's a good, healthy, dose of stewardship that goes into it. But at the same time, yeah, it's not going anywhere anytime soon. So I do think there will forever be, evolving infections and bugs and resistance and things like that to keep me busy.
So you mentioned your student loans. Tell us a little bit about the schooling and then training it takes to become an infectious disease doctor.
Yeah, sure thing. So obviously, you start with an undergraduate degree and then medical school, but then from there, you do have to do an internal medicine residency, obviously like what we did together. And then from there, you can go on and do fellowship in infectious disease, but that offers, I think, a little bit of variability. Most programs are 2-year programs. That's how mine is structured. Some programs will give an elective opportunity for a 3rd year of research. I think that's often based on funding that you can obtain. The programs are obviously a spectrum. You really can kind of choose a fellowship program that is really geared towards research, or one that's maybe more clinically heavy, or somewhere in between. I think I'm probably in that sort of Goldilocks phase where we do a lot top-notch research, but at the same time, we're very clinically oriented as well. So after fellowship, really, you have an opportunity. Some people do subspecialize even further into something like transplant infectious disease, which is typically another year of training beyond that. There's sort of an emergent field in orthopedic infectious disease that works very closely with orthopedic surgeons, really sort of managing prosthetic joint infections, osteomyelitis, things like that. So, I feel like in a lot of these fields, you can obviously, continue to find your niche and, subspecialize further and further and further until you're really narrowing your scope of practice. But at the bare minimum, after your 3 years of internal medicine residency and 2 years in infectious disease, you're really ready to go as an attendant in the specialty.
Dave, tell us a little bit about what people who are interested in infectious disease as a potential career can do to kind of bolster their CV and their application when they're considering applying to fellowship.
I can say that, for certain individuals who may be more research focused and trying to obtain fellowships at very, highly established research institutions, then obviously that's the name of the game, is getting involved in research projects early. And that doesn't always necessarily mean bench work in the lab. There's a lot of clinical research opportunities out there. You could talk to anyone in your ID department, and I'm sure someone's, investigating some clinical questions somewhere. But ID has a nice scope of practice as well, where it's not confined to just lab work or clinical work. We do a lot with antibiotic stewardship, how we prescribe antibiotics, the appropriateness of such, as well as infection control. So you really don't have to limit yourself to, very narrow questions of, clinical importance or bench work. Find any project. And I think the name of the game is not necessarily spreading yourself too thin and dipping your fingers into a bunch of different projects that you're not really going to make a strong impact on. But if you follow along and have longevity in one particular area or aspect, I think any program director, and I know for a fact because when we went through the interview process, we fellows were involved with that, and how we kind of analyze candidates. And, you can kind of tell who has a deep-seated interest, early on, and that's very obvious from someone's file. But yeah, otherwise, you don't have to do anything super crazy. I think you make it pretty apparent on your application when you have demonstrated early on that there was an interest. And truthfully, if you really don't know, as most medicine interns and then residents do, and you're a late bloomer to the field, we're still happy to have you because some of the best bacteria are slow growing. You have to just give them time.
Fantastic reference. What do you plan on doing? I know you mentioned a couple of subspecialties. Do you plan on, completing your 2 years and calling it a day, or do you plan on going into one of these like very specialized niches?
That's a good question, and one that I think my program leadership wants to know the answer to as well. I personally think that I'll probably favor calling it quits at the end of all this. I think, we can only train for so long. I'm pretty interested in HIV and hepatitis C, so I foresee myself hopefully maybe, serving the underserved population up in the mountain communities out here in Denver. Summit County has, pretty high rates of HIV and Hep C with really poor access to care. So, if my life turns into a small mountain clinic around Vail or Breckenridge, somewhere around there, and I see my patients in the clinic, but also attend a few of the hospitals in the area, that sounds like a pretty sweet gig to me. So I don't think there's more training in the future.
You certainly can't beat the landscape out there. I know you said you had a view of the Rocky Mountains, and then the activities. You're a big skier, you're a big rock climber. I know your forearms are something that Thor would be jealous of. So tell us a little bit about how you maintain a good work-life balance. I know training is difficult, but how do you find time for these extracurricular activities?
Yeah, I think it's true for any specialty too, where you make the time, whatever is important to you, and if balance is important, you got to make the time. Some specialties certainly dominate what free time you'll have more than others. Another reason why I probably lean towards infectious disease, because by no means are any of these specialties not busy, but I think there are some that, I wasn't looking to get called at 2 a.m. to run in and scope someone. I felt like I could handle a lot of the stuff from home, and, there's a lot of, start them on this, we'll see them tomorrow. I think that when you are really sort of trying to consider which route you're going to go in your career, you have to look very honestly and transparently at your interests and whether balance is important to you. And it obviously is to me by all the hobbies that you mentioned. But yeah, we try to do, I think, a lot of like retrospective analysis on what we do. And I think a lot of us, maybe push aside some of our hobbies and things that would be really important to our wellness to chase down professional dreams. But at a certain point, you have to be real with yourself about what you want. So luckily, my specialty allows me to make sure that things outside of work, like climbing, skiing, hiking, all those sorts of things, I still have plenty of time to do it.
That's fantastic, Dave. Hopefully someday I'll be able to make my way out there, and we might be able to shoot a YouTube video of me attempting to climb, but maybe we can ski together or something. A little more fun.
Anytime, buddy. Yeah. Anytime.
Dave, I think this has been really, awesome. I thank you so much for coming on today. I think our viewers are really going to enjoy this. If anybody has any questions about infectious disease or anything to add or anything really, just drop it in the comments below. We'll make sure to get back to you. Otherwise, again, Dave, I really appreciate you coming on today. Thank you so much.
Chad, my pleasure. Anything for you, man.
All right. Until next time, everyone, have a good one.